Hello, and thank you for attending the Venous Study webinar. Hello, everyone. This is Nicole Pearson, and I'd like to thank you for attending the Venous Study webinar. If you have any questions throughout the webinar, please type them into the questions section of your GoToWebinar panel. They will be addressed at the end of the webinar. Today we will look at identifying chronic venous insufficiency patients, performing the venous study, reimbursement for your venous study, sending and receiving your tests, and your next steps. We'll start today with identifying our CVI patients. Chronic venous insufficiency is a disease that is progressive in nature. It is caused by damaged valves in the veins or venous blockage. More than half of all venous ulcers require prolonged therapy lasting more than 1 year. Chronic venous insufficiency can lead to more serious conditions if it's left untreated. There are a lot of misconceptions about vein disease. Some of these misconceptions include varicose and spider veins being strictly cosmetic, varicose vein symptoms being inevitable manifestations of aging, so there's nothing that can be done, that one should wait as long as possible before seeking treatment in order to take care of it all at once, that women should wait for treatment until after they are done having children, and that treatment requires painful surgery and prolonged downtime. So today we'll take a look at some of these misconceptions and hopefully clear them up for you. Over 30 million Americans are affected by chronic venous insufficiency, and out of those 30 million, only 1.9 will seek treatment. Without treatment, those with CVI may experience progressive symptoms that can be debilitating and significantly impact the quality of life. In fact, more people lose work over vein disorders than from artery disease. Without treatment, chronic venous insufficiency can lead to leg pain, fatigue, and heaviness, pigmentation changes, varicose veins, swelling, cellulitis, and eventually blood pooling or stagnating in the blood vessels can cause ulcers or sores to develop. Venous stasis ulcers form when drainage of fluid is inadequate. Malfunctioning valves in your veins allow the blood to stagnate, and this can spell trouble because when blood pools, it can clot, causing superficial clots or phlebitis. A pulmonary embolism usually happens when a blood clot called a deep vein thrombosis, or DVT, travels to your lungs and blocks a blood vessel. This leads to low oxygen levels in your blood, and it can cause damage to the lung and other organs. It can also cause heart failure. And then finally, when veins become distended with blood and weakened from chronic pressure on them, they can hemorrhage or burst. Some risk factors for chronic venous insufficiency include a family history of CVI or deep vein thrombosis, patients that are 30 years or older, patients that spend long periods of time sitting, standing, or do heavy lifting, your patients that are female, especially those with multiple pregnancies, patients with a prior blood clot history in superficial or deep veins, your patients that are obese or live a sedentary lifestyle, and those with high blood pressure and limited physical activity. Indications for chronic venous insufficiency studies include varicose veins with ulcer, varicose veins with inflammation or infection, varicose veins with pain, swelling, and/or edema, phlebitis, and embolism. Now we'll look at actually performing the venous study. Your patients should be dressed in non-restrictive, comfortable clothing. Their lower extremities, at least from the knee down, should be exposed for cuff placement. Your patient does need to refrain from smoking for at least 30 minutes before the test. This test does have a required rest period of 3 minutes. For the test, you will have your patient sit in a stable chair near the edge of their seat. Patients should sit slightly slouched back with their knees slightly greater than 90 degrees. During the rest period, you can explain dorsiflexions to your patient as they will be performing these foot pumps during the test. It is important that they just watch you do these foot pumps and not actually try to perform them themselves, because we do need them to be as still as possible during their rest period. Here's an example of a dorsiflexion or a foot pump. Leaving their heel on the floor, the patient will raise the ball of their foot up, then push it back down. This should be a vigorous exercise and not a gentle foot tap. If the patient is unable to do dorsiflexions due to a lot of edema or leg heaviness, they can perform heel lifts as an alternative. From the home screen of the PADnet software, you will click Perform New Venous Test. Once you click the Perform New Venous Test link, the demographics screen opens up. Entering the demographic information is pretty straightforward. Required fields are marked with a red exclamation point. After the patient demographics and insurance information is entered in, the risk factors can be entered into the History tab. On the Physical tab, the CEAP classification should be filled out for each extremity. For those not familiar, the CEAP classification system is used for the severity of varicose veins. The primary indications for the venous study can be selected on the Indications tab. And once you're ready to start the venous test, you can find the Perform button on the Venous Test tab. The venous sense cuff should be placed on the calf. As you can see here, the cuff is placed slightly cone-shaped. You can also use the arterial cuff from your PADnet study if this is more convenient for you. The gray hose should be plugged into the venous sense cuff port on the DTU for this test. Once the venous refill test screen is displayed, press Start. The cuff will inflate, and when the graph displays a flat baseline for at least 2 seconds, the patient should begin dorsiflexions with their foot. The patient should complete at least 5 dorsiflexions or more. Have the patient stop when the waveforms show that the blood has evacuated above the maximum level of the cuff, as you can see in the second graph. Upon completion of the dorsiflexions, the patient should rest with no movement. At this point, you'll let the graph run until the tracings are off the screen, and then press Stop. Next, you'll actually determine the refill time for your patient. Your first click will be on the point in the tracing that represents the point at which the patient stopped all movement. And we can see that here on the left side of the graph. We have it circled in red. This is the southernmost point of the entire trace. Your second click will be at the point where the refill line first begins to plateau, or where the refill time crosses over the top red line. And we can see that here over on the right side of the graph. A normal refill time is 25 seconds. Once you complete your testing, save and sign your test and make sure your reader is selected. From the home screen, click the Send Receive Test link and send your test out to your reading physician. For those of you that do your own readings, you should still follow these steps and electronically send the test to yourself. Your interpreted test will come back into your system after you click the Get Scored Test button. These tests will show up in the interpreted filter on the left side of the screen. The venous study is a reimbursable test. The CPT code that should be used is 93965. This code generally pays around $100. Marketing materials in your waiting area are a great educational resource for your patients. We have trifold brochures that explain chronic venous insufficiency. They also explain the test prep, what the patient can expect during the procedure, and that there is no downtime following the study. The patient questionnaires are a great tool for determining risk factors and indications for chronic venous insufficiency studies. These questionnaires can be handed to the patients after they are brought back to their exam rooms. The questionnaires help tell the patient's story, and they often yield information that he or she may not tell you directly. Here we have examples of the questions on the Venous questionnaire. Remember, as long as your patient checks at least one box, they are able to have a reimbursable study performed. In addition to questioning your patient, there are also visual cues that you can look for. Patients with chronic venous insufficiency can present with varicose veins or a reddish-brown discoloration of the lower extremities. Additionally, you can use your ring finger to palpate behind the patient's calf. Sometimes you may not be able to see the varicose veins, but you'll be able to feel them. Your EMR is a really powerful tool for generating lists of in-need patients that you already see. Reports can be generated based on diagnosis, such as phlebitis, embolism, and varicose veins. You can also generate reports, patient lists, or queries based on certain risk factors, such as age or obesity. Remember, patients with a primary indication can be scheduled immediately for venous testing, and those patients on your risk factor list all need questionnaires. After your venous study is interpreted, you will either refer the patient out for further treatment or you'll treat the patient yourself, depending on your specialty. This flow sheet shows an example of the next steps for mild, moderate, and severe chronic venous insufficiency. For mild CVI, a venous Doppler can be performed annually, and the patient should be educated on venous health, including exercise, compression stockings, etc. Patients with moderate CVI should have a biannual venous Doppler, venous education, and the patient should be assessed for the progression of the disease, and continuous monitoring for venous ulcers, venous hypertension, and DVT is recommended. Patients with severe chronic venous insufficiency should have a venous Doppler performed every 3 to 6 months, along with venous education. Additionally, intervention and/or ablation is recommended. Thank you very much for your time this afternoon. We do look forward to providing additional continuing education courses. As always, please let us know if we can help you in any way. Thanks so much.